Let's start with a brief look at prostitution laws in Canada. Did you know that prostitution is one of Canada's oldest professions, dating back centuries before Canadian Confederation? Did you know that advocacy for the decriminalization of sex work started back in the 70s, led by sex workers themselves? Did you know that in the late 1980s, Canadian police were known to use sex work legislation to prosecute people for non-sex work related crimes? Something that continues to happen under current laws? Did you know that in 2013, the Supreme Court of Canada declared the existing criminal code sections on prostitution unconstitutional? The courts declared that any social benefits of ending the sex trade were not comparable to the damage caused to sex workers by criminalization. Did you know that Bill C-36, or End Demand legislation, prevents the criminal prosecution of sex workers, but still criminalizes most other aspects of the sex trade, including those who provide support to sex workers themselves? Did you know that despite of all of this, little has changed for sex workers who largely are still experiencing violence, marginalization, stigma, and poverty? Some believe the current laws are equally or more damaging to the well-being, safety, and security of sex workers in Canada. The following website was created to explore and present the impacts of criminalization of sex work in Canada and advocate for the full decriminalization of the trade to better support the safety, security, health, and well-being of workers in this field.
Bill C-36 is the Protection of Communities and Exploited Persons Act. It treats prostitution as a form of sexual exploitation. This bill attempts to protect the dignity and equality of all Canadians by prohibiting the purchase of sexual services, the development of economic interests in the perceived sexual exploitation of others, and the institutionalization of prostitution through commercial establishments and things like strip clubs and massage parlors. At this time, any individual who sells or promotes their own sexual services are not considered criminally liable. Rather, it would be the purchaser who is committing the criminally liable act. The maximum penalty for somebody prosecuted for purchasing sexual services can vary. And that brings us to decriminalization. So what is it and what does it mean for this population? So first, it's important to note that decriminalization is distinct and different from legalization. Decriminalization of sex work entails removing the criminal penalties associated for it. New Zealand was actually the first country to do this over a decade ago, and since that shift, they have found that the decriminalization has been successful in making conditions safer and improving the rights of sex workers. With legalization comes overbearing regulations and infringes on the sex workers' autonomy and would give the worker less say in who they work for, how long they work with, that type of thing. Basically, decriminalization would acknowledge that sex work is a part of the service industry just like any other job and allows those workers to operate under the same legal and employment rights. And it's important to note that it does not entail the removal of criminal provisions against trafficking, sex slavery, and underage sex work. This brings us to the working environment. Removing the criminal restrictions would protect the rights of workers as well as help remove stigma, social exclusion, and decrease the potential for violence, altering the work environment and the safety of the workers. The United Nations and the World Health Organization both support the decriminalization of sex work in order to protect the workers' rights. When it is criminalized, these workers are faced with inequities in obtaining human rights and are overtly subjected to abuse with barriers to legal recourse against the perpetrators. Overall, the criminalization of sex work is a futile and cyclical process that is directly tied to violence, incarceration, and drug use. The decriminalization of this work will provide workers with the same legal protections afforded to all other workers.
In Canada, End Demand legislation unintentionally contributes to widespread negative health impacts for sex workers. Laws which intend to improve and protect the safety and security of workers in reality act to deter countless individuals from seeking the physical and mental health care they so desperately need. Stigma is one of the largest barriers preventing sex workers from accessing health care. Sex workers fear judgment, negative treatment, and punitive measures by healthcare workers, which prevents them from seeking medical care. Sex workers are at a significantly higher risk for poor health outcomes, including injury resulting from violence or abuse, as well as sexually transmitted infections and HIV. Avoidance of the medical system and emergency services places workers at extremely high risk for isolation, mental health disorders such as depression, and suicide. The criminalization of third-party players in the sex trade further contributes to the inequities in healthcare access for sex workers. This is due to the proven support role which third-party players occupy when it comes to the protection and promotion of their health. Decriminalizing sex work in Canada would combat stigma and support sex workers in accessing essential health care. Decriminalization would also allow for better education of healthcare workers and allow for continued research in the area to identify the experiences, barriers, challenges, and needs of sex workers to shape future sex trade policy in Canada. Punitive measures have proven to be ineffective, and it's time Canadian law shifted to decriminalize all aspects of sex work and protect the health and well-being of the vulnerable.
The risk of violence is prevalent in the sex trade industry. It has been stated that 82% of those who consensually work in the sex trade have been victimized by violence while working. And in Canada, 62% of those victims have chosen to not formally report these crimes. Notably, since implementing in-demand legislation, these statistics have not significantly changed, despite the stated intentions of the bill to decrease violence against sex workers. Sex workers remain fearful to report their abusers for fear of being charged with crimes related to the sex work industry themselves. Methods for reducing exposure to violent events include screening potential clients, working with other sex workers, and conducting business in monitored environments. However, the ability to implement these harm reduction efforts is severely compromised by the current laws surrounding the sex work industry. Decriminalization of sex work supports the workers' rights to a safe working environment by allowing them to choose where they work, to hire security personnel, allows workers to practice collaboratively, provides the opportunity for client screening, and gives workers more control to refuse work or clients they feel are unsafe. By taking a closer look at the determinants of health that affect this population, as previously discussed throughout this presentation, our goal was to connect those factors with the community nursing standards of practice, to create an advocacy initiatives appropriate for community nurses to implement their practices, while also building capacity for those people engaged in sex work to be able to advocate for it themselves. Groups including the Canadian Alliance for Sex Worker Law Reform have published advocacy guides, which we have linked to our website to provide viewers with an overview of the advocacy efforts that are already underway across Canada. Furthermore, the Canadian Alliance for Sex Worker Law Reform provided a template to support allies of sex workers and those personally engaged in this work to connect with lawmakers and express their concern. We provided a copy of this letter on our website to help contribute to making this template readily available. December 17th is International Day to End Violence Against Sex Workers. Links to community agencies that organize events around this date have been provided to promote attendance to these actions and further reach the spreading of awareness, as well as show support through numbers. An important part of advocacy is to include those who are directly affected when planning advocacy efforts, by working with the population to address their needs and improve their current situation. Our website was designed to be user-friendly and provide a holistic overview of how the social determinants of health, influenced heavily by the current Canadian legislation, contribute to health inequity for this population. Our website link was then shared with local organizations who currently provide social supports for this population. Our goal was to raise awareness of these issues through our research by engaging in collaboration with current advocacy groups. However, in the time of this presentation, none of the groups we attempted to make contact with have responded. Additionally, to raise awareness through medical communities and encourage discussion of our topic as an advocacy initiative, our link was shared with a nursing educator who provides guidance to approximately 75 medical staff working in an ER at a regional hospital. The goal was to have our link shared with the medical professionals who come in contact with this population regularly. At the time of this presentation, we are still waiting for the nurse educator to review our contact, before including the link to it in the monthly hospital newsletter. At this time, we'd like to thank you very much for attending our presentation. We'd like to open the floor to any questions that you may have. Thanks again.